Hi, my name is Dr. Luke Reineck. I'm the chiropractor and owner of Living with Motion Chiropractic in Loveland, Ohio. Shoulder pain is one of the most common things that we see in our office. It could be ranging from rotator cuff issues to impingement syndrome to just common aches and pains. So in this video today, we're going to highlight how we muscle test your rotator cuff, how we muscle test muscles that stabilize your shoulder, and then we're going to also show you some of the different treatments we do, from chiropractic treatments to shockwave therapy that we also do to manage your shoulder pain. Thanks. When you come into our office with shoulder pain, the first thing we have to do is figure out where it's coming from. So we're going to go through an example of how we test the rotator cuff. Those are often causes of shoulder pain. But next, we'll also test muscles that stabilize your shoulder. We'll go through some of those examples so you can have a good idea of how we assess you, so we know what to treat with chiropractic adjustments and also shockwave therapy. So the first we're going to do is a test for supraspinatus. So here we have the arm rotated face down, or thumb pointing down. I'm going to apply pressure, hold. We're just looking for resistance there. The next, we're going to go into your external rotator cuff. So Maggie's going to push back at me. We have resistance. We want to make sure that muscle's strong. Next, we're going to slide down here to your infraspinatus. I'm going to be pushing in. Once again, we're looking for strength. Hold. She's strong in all those. And lastly, she's going to put her hand on the back of her back. I know you can't see this, but what she's looking for is to see if you can lift your hand off her back for your subscapularis, which she can't. So those she all passed. After we test the rotator cuff to make sure those muscles are strong, the next we'll get into the muscles that stabilize the joints. So the first joint is the glenohumeral joint itself, where the socket fits, the ball of the humerus fits into the socket of the shoulder. To do that, we have a straight arm. We bring it down a few degrees and we check the strength here. She's strong with that position there. And of course, before we do all this, we always examine the neck. The neck is crucial for making sure the shoulder is strong. So we're assuming we already did that with her. The next, we're going to check her SC joint, her sternoclavicular joint. So this, I'm going to try to pull her arm towards me. She's going to resist. We're just looking for that strength there. And next, for her AC joint, acromioclavicular joint, I'm going to bend here, and we're basically just trying to push her elbow towards her foot. And we'll make sure that stays strong. Hold that. Great. Next, we're going to show you what a hypothetical treatment looks like. For this one, we decided to use the supraspinatus, which basically runs right along the ridge of your scapula there. This is a very common one to have injury to the muscle, different trigger points that mess up the function of that muscle and often test weak. So we're going to do some shockwave. I already have some ultrasound gel here, so you can see how that gets treated. Once again, the point of shockwave is to help that tissue heal. We use acoustic waves come through the tip of the shockwave. Breaks down some of that scar tissue, adhesions in the muscle. We get some tissue regeneration with healthy collagen production. Works great for shoulders. We might also come around the outside of the deltoid here, coming across your shoulder. Typically, we're doing this for a few minutes, and we're addressing all the muscles in the rotator cuff that tested weak during your exam. So for her with the neck, you got right at the top. So it's nothing more than a lateral bend and a little push through the joint. Just remember, all those nerves coming out your neck, coming to the shoulder, into the different tissues, muscles. We want to make sure all those pathways are clear. And then, so for this example, we're going to have Maggie put her hand there. I'm going to adjust through her shoulder. I'm going to get my hand right underneath there and just lean on her a little bit with a push there. And that's how we would treat your neck. and shoulder for that specific example in our office. So if your shoulder is causing you troubles, you're unsure what to do, whether it's going to an orthopedist, physical therapy, I would highly recommend coming in to see us here at Living with Motion, where we can assess your shoulder for you. We have multiple treatment options that are going to get you healthy, but also look at you the whole person, from your neck to your mid-back to your shoulder. All those things work together. You have to have those nerves functioning properly. That's why we use chiropractic adjustments to unlock those nerves so they can control the muscles effectively. And we see that through the different muscle testing that I showed you. One thing I didn't mention is that, of course, then we prescribe you the right exercises for your shoulder. Doing the therapies, getting it healthy again, but then we got to use strength to do that. And so we try to treat each individual as a unique person, depending on what they got going on in the shoulder. I'm certain that you're going to get some shoulder relief for sure. Thanks.